We'd like to welcome Ms. Joyce Golphin, the current president of the APHA. Welcome.
Thank you so much.
You have traveled the world being the president of the APHA. What are some of the most exciting things you've heard from the affiliates around the country?
I am so excited to say that the affiliates are starting a comeback. We had several hard years where affiliates were losing many members, and some affiliates are challenged with a lot of their senior members are starting to leave, but they are growing and expanding. And I think one of the most exciting things is how involved they are in looking strategically at new ways and new partnerships to make public health work with the healthcare system under the Affordable Care Act requirements. And so many of our affiliates represent organizations that are now really engaged in public health accreditation. And that means that they are doing things like community health assessments and community health improvement plans. As my good friend Dr. Barry Levy, who's a former president of APHA, used to say, we're really putting the public back in public health.
What advice would you give to students who are interested in public health careers?
That has been one of my greatest opportunities this year, as I've met with many student groups. We've had breakfast, lunch, dinners, and I've even done some career development workshops for the students. And these are enthusiastic and well-prepared individuals. They have big ideas, they're not jaded by the system, and they still imagine that there's a lot of possibility. I would tell students, as I have before, volunteer for as many things as you can and learn how to translate that volunteer service into positions and help you get jobs. And as they've done this, I said it doesn't matter how you get your leadership experience, but do volunteer to be a leader. And another thing I tell the students is don't worry that you don't know everything. Go ahead and do what you can. Second thing I tell students is find yourself a mentor or two. That was certainly part of my career that helped me be as successful and become APHA president someday. Mentors are people who not only are role models to you, but they are people who can open doors for you and take you to places like an APHA conference where you will meet individuals that you might not otherwise have a chance to meet. Very important things for students.
In your opinion, how can we strengthen the U.S. public health infrastructure?
I've found traveling around the country, I've been to 29 of our affiliate organizations, that some states have pretty strong systems, like my state, Utah, has a very strong infrastructure for public health. And other states are very much on the brink, including our great hosts here in Louisiana and some of our other states specifically. And one of the things we're trying to do is to change all of healthcare and our outcomes so that we have a healthier population in this country, because unlike a lot of people really think, the United States is not leading in the outcomes in public health, and we spend more than twice as much as the next highest peer country spends on healthcare. If we could spend our way to a better system, we would have done it by now. In what is known as the AAA, we're looking for improvements at individual health care and outcomes for better population health and bending the cost curve down. And we need a strong public health infrastructure to do this. For years, our systems have been quite devastated, and ever since I started working in public health 41 years ago, people would say, they don't understand or value public health until something big happens. Well, we have just seen something big in the form of Ebola happen. And we said it wasn't going to be a huge outbreak. It was going to be contained within our country, and the people who were telling us have been proven correct. But we need to make sure that people understand what we do and how we do it and include more partners in that process. I don't think we really articulate the value of our programs. We put out a lot of reports with a lot of numbers and statistics. We need to remember to tell stories about the impact on individuals and families and what our work does to make their lives better.
And lastly, how do you think we create a better pipeline for public health leaders?
A better pipeline for public health leaders starts in the affiliates and in APHA. Our organizations are designed and welcoming for students. In fact, we spent a great part of our executive board session over the last 2 days talking about how we not only grow APHA, but the important role for students in the American Public Health Association and at the affiliate level. And they have an opportunity to join these professional organizations where they can meet the leaders that they hope to become someday. And they will get training, we offer webinars. These are the people that help us learn social media skills and how to apply things to a new generation. So I encourage all students, join your affiliate organization, join APHA. We have a place for you. Our student assembly in APHA is the largest component unit we have, and they have their own student leaders, and we have even one of those set on our executive board. They get to see leadership at the very highest levels.
Thank you for your time today, Joyce.
Thank you.